Chapter 8 is TRICARE and Veterans Healthcare. Our key terms: ADSM is an active duty service member, an active member of the United States government military services, for example, the Army, Navy, Air Force, Marines, and Coast Guard. Allowable charge: an amount on which TRICARE figures the patient's cost share for covered care. This is based on 75 to 80% of the allowable charge. Authorized provider: a physician or other individual, authorized provider of care, or a hospital or supplier approved by TRICARE to provide medical care and supplies. Beneficiary: an individual entitled to receive insurance policy or government program healthcare benefits, also known as participant, subscriber, dependent, enrollee, or member. Catastrophic cap: the maximum dollar amount that a member has to pay under TRICARE or CHAMP VA in any fiscal year or enrollment period for covered medical bills. Catchment area: in the TRICARE program, an area defined by zip codes that is approximately 40 miles in radius surrounding each United States military treatment facility. Cooperative care: a term used when a patient is seen by a civilian physician or hospital for services cost-shared by TRICARE. COB, which is coordination of benefits: when two insurance carriers working together and coordinating the payment of their benefits so that there is no duplication of benefits paid between the primary and secondary insurance carriers. In TRICARE, the coordination of the payment of TRICARE benefits with the payment of benefits made by the double coverage plan so that there is no duplication of benefits paid between the double coverage plan and TRICARE, likewise applied to disability programs. Cost share: the portion of the allowable charges, 20 or 25%, after the deductible has been met that the TRICARE patient is responsible for. DEERS, Defense Enrollment Eligibility Reporting System, an electronic database used to verify beneficiary eligibility for individuals in the TRICARE programs. Department of Veterans Affairs, the federal agency that oversees healthcare services to military, veteran, and determines eligibility of beneficiaries. Emergency: a sudden and unexpected medical condition or the worsening of a condition that poses a threat to life, limb, or sight and requires immediate treatment to alleviate suffering, for example, shortness of breath, chest pain, or drug overdose. HBA, Health Benefits Advisor, an individual at military hospitals or clinics who is there to help TRICARE beneficiaries obtain medical care through the military and through TRICARE. HCF, Healthcare Finder, healthcare professionals, generally registered nurses, who are located at TRICARE service centers to act as a liaison between military and civilian providers, verify eligibility, determine availability of services, coordinate care, facilitate the transfer of records, and perform first-level medical review. Healthcare finders help TRICARE beneficiaries and providers with pre-authorization of medical services. Medically or psychologically necessary: medical or psychological services considered appropriate care and generally accepted by qualified professionals to be reasonable and adequate for the diagnosis and treatment of illness, injury, pregnancy, and mental disorders, or that are reasonable and adequate for well baby care. Military Treatment Facility, or MTF, all uniformed service hospitals or health clinics, also known as military hospitals or uniformed service hospitals. Non-Availability Statement, or NAS, a certification from a military hospital stating that it cannot provide the care needed by the beneficiary. Non-participating physician or provider. A provider who does not have a signed agreement with Medicare and has an option about assignment. The physician may not accept assignment for all services or has the option of accepting assignment for some services and collecting from the patient for other services performed at the same time and place. Also, a provider who decides not to accept the determined allowable charge from an insurance plan as the full fee for care. Payment goes directly to the patient in this case, and the patient is usually responsible for paying the bill in full. OHI, Other Health Insurance. Healthcare coverage for TRICARE beneficiaries through an employer, as association, or private insurer. A student in the family may have a healthcare plan through school. Participating physician or provider. A physician who contracts with a health maintenance organization or other insurance company to provide services. A physician who has agreed to accept a plan's payments for services to subscribers. For example, some blue plans. 80% of practicing American physicians are participating physicians. A physician who agrees to accept payment from Medicare, 80% of the approved charges, plus payment from the patient, 20% of approved charges. One who accepts TRICARE assignment, payment goes directly to the provider. The patient must still pay the cost share outpatient deductible and the cost of care not covered by TRICARE. Partnership Program, a program that allows TRICARE eligible individuals to receive inpatient or outpatient treatments from civilian providers of care in a military hospital or from uniformed service providers of care in civilian facilities. Point of Service Option, or POS. Individuals under the TRICARE program can choose to get TRICARE covered non-emergency services outside the prime network of providers without a referral from the primary care manager and without authorization from a healthcare finder. Pre-authorization, a requirement of some health insurance plans to obtain permission for a service or procedure before it is done and to see whether the insurance program agrees that it is medically necessary. PCM, Primary Care Manager, a physician who is responsible for coordinating and managing all of the TRICARE beneficiaries' health care unless there is an emergency. Regional Contractor, for TRICARE and CHAMP VA, the insurance company that handles the claims for care received within a particular state or country, also known as claims processor and formerly known as fiscal agent, fiscal carrier, or fiscal intermediary. Service Benefit Program, a program, for example, TRICARE, that provides benefits without a contract guaranteeing the indemnification of an insured party against a specific loss. There are no premiums. TRICARE Standard is considered a service benefit program. Service-connected injury, injury incurred by a service member while on active duty or incurred during reserve duty with a military unit. A service or military retiree, an individual who was retired from a career in the armed forces. A sponsor. For the TRICARE program, the service person, active duty, retired, or deceased, whose relationship makes the patient or dependent eligible for TRICARE. Summary Payment Voucher, the document that the fiscal agent sends to the provider or beneficiary showing the service or supplies received, allowable charges, amount billed, amount TRICARE paid, how much deductible has been paid, and the patient's cost share. Total Permanent Service Connected Disability, a total permanent disability incurred by a service member while on active duty. TRICARE, a government-sponsored program that provides military and non-military hospital and medical services. It covers spouses and dependents of active service personnel, retired service personnel and their dependents, and dependents of members who have died in active duty. TRICARE Extra, a preferred provider organization, PPO, type of TRICARE option in which the individual does not have to enroll or pay an annual fee. On a visit-by-visit basis, the individual may seek care from an authorized network provider and receive a discount on services and reduced cost share or copayment. TFL, TRICARE for Life, a healthcare program that offers additional TRICARE benefits as a supplementary payer to Medicare for uniformed service retirees, their spouses, and survivors aged 65 years of age or older. TRICARE Prime, a voluntary HMO type option for TRICARE beneficiaries. TSC, TRICARE Service Center, an office staffed by TRICARE healthcare finders and beneficiary service representatives. TRICARE Select, a fee-for-service, self-managed, preferred provider network plan for TRICARE beneficiaries, which became effective January 1, 2018, and replaced the TRICARE Standard, TRICARE Extra, and TRICARE Standard Overseas programs. TRICARE Standard, a TRICARE coverage option offered to beneficiaries prior to 2018 and replaced with TRICARE Select. Urgent care, medically necessary treatment that is required for illness or injury that would result in further disability or death if not treated immediately. Veteran, any person who has served in the armed forces of the United States, especially in time of war, is no longer in the service, and has received an honorable discharge. CHAMP VA, or Veterans Health Administration, formerly known as Civilian Health and Medical Program of the Department of Veterans Affairs, a program for veterans with total, permanent, service-connected disabilities or surviving spouses and dependents of veterans who died of service-connected disabilities. Our key abbreviations, we have ADSM, Active Duty Service Member. CHAMPUS is Civilian Health and Medical Program of the Uniformed Services. CHAMP VA is Civilian Health and Medical Program of the Department of Veterans Affairs. COB, Coordination of Benefits. DEERS, Defense Enrollment Eligibility Reporting System. HBA is Health Benefits Advisor. HCF, Healthcare Finder. MHS, Military Health System. MTF, Military Treatment Facility. And NAS, Non-Availability Statement. Non-PAR is non-participating provider or physician. OHI, other health insurance. PAR is participating physician or provider. PCM, primary care manager. POS, place of service. SHCP, supplemental healthcare program. TFL is TRICARE for Life. TMA is TRICARE Management Activity. TPR is TRICARE Prime Remote. TSC is TRICARE Service Center. And the VA is Veterans Affairs.